City of Lubbock is so grateful to partner with Covenant Health, Texas Tech University Health Science Center, and UMC Health System to bring you a women's health town hall. Tonight, our panel of experts will answer questions from the public and media regarding COVID and the vaccines as they pertain to women's health. So joining us on the panel tonight, we have Dr. Bennet Henderson, specializing in obstetrics and gynecology at Covenant Health, Dr. Jessica Gray, specializing in family medicine at UMC Health System, Dr. Sarah Mallard Wakefield, specializing in psychiatry at Texas Tech University Health Science Center, Dr. Vanessa Dalton, specializing in pediatric medicine at Covenant Health, and Dr. Sharilyn Almodovar, a scientist specializing in immunology and molecular microbiology at Texas Tech University Health Sciences Center. And for the City of Lubbock, we have Director of Public Health, Catherine Wells, and I'm Lacey Nobles. We asked the public to submit questions, and we have organized them into categories from new moms to fertility to vaccines and pregnancy. So we will start with the new moms category. Would a baby receive any immunity against COVID if a mother becomes vaccinated while breastfeeding or during pregnancy? So, Dr. Henderson?
So, yes, women who are breastfeeding and have been vaccinated will pass antibodies into their breast milk. These can also cross the placenta and are a good way to provide immunity to vulnerable newborns. Studies have been done in JAMA in May of 2021, where they looked at women who received the vaccine, and within 2 weeks, they had anti-COVID antibodies within their breast milk, and those continued to rise and sustain over the period of that study. And then they also looked at women who received the vaccine in pregnancy, 36 of which, all of the women, 36 women, when they delivered their baby, all of their babies had antibodies. So that's pretty fantastic. So definite evidence that those antibodies will cross both into breast milk and through the placenta to baby.
Okay, thank you. And I am fully vaccinated and currently breastfeeding. However, I may be weaning soon. How much breast milk is needed daily to keep my little one covered with the antibodies?
So this is more difficult to answer. We know that antibodies do cross into breast milk, but the difficult part is knowing the exact level of antibodies that provide protection. So that's something that we're still studying, and we'll have more information as we have more time and data. But at this point, as long as you desire to breastfeed, is a good amount of time to breastfeed your baby, and while you are, you can pass those antibodies on.
Okay. Thank you, Dr. Henderson. Now, the I've heard category. I've heard the vaccines were initially tested and created using fetal cells, and this is something that makes me not want the vaccine for religious and personal reasons. Is this true, or is this another myth? Dr. Gray, we'll start with you and then follow up with Dr. Almodovar.
So this has been a common myth that I've heard quite a bit about, and so there's a half and half to this question. So fetal cell lines have been previously used in the creation of several other vaccines that are very common to us. Some of those vaccines include the hepatitis A vaccine, the rabies vaccine, chickenpox, and the German measles vaccine. All this information can come from the Vaccine Education Center and is readily available to anyone who wants to read about it. These cell lines that were used are about 60 years old, so these are old cell lines. But the good news here is, if anybody that has concerns about it or thinks this is a reason why they might hesitate to get the vaccine, is that both the mRNA vaccines, so that's going to be your Pfizer and your Moderna vaccines, were not derived, they're not derived, and never were derived at any point in time from fetal cells. So that's good news for anybody who had those concerns as a reason why they were maybe being not going to get that vaccine done. The J&J and the AstraZeneca vaccines were derived using fetal cell lines. These cell lines are from the 1960s and 1980s, similar again to what those Hep A, rabies, chickenpox, and German measles vaccines were used for. The Catholic Church has already come out in the past, whenever this discussion was initially brought up years ago, about those previous vaccines that we give to children, and they were all in favor of the fact that these vaccines prolong life, and that's the most important thing for the church, so they are very happy to say that this is, they've commented on it and approved it.
Definitely, I would like to add from the scientific point of view what happens in a research laboratory. In this case, whenever it's absolutely necessary to use some cells, we are not using cells that are coming, or we're not recruiting women to get abortions done to use their cells for that reason. Like she said, all of these cells have been frozen, or they have been obtained since 1960s. 1973 actually is the one that they were using for these vaccines. So it is important to understand that the cells that we use are really frozen, and it's the same kind of cell type that we use all over the place. All of the time, we are not recruiting women to get abortions and use their cells, actually. So I would like to clarify that.
Thank you all so much. Okay, now we move to fertility. I'm a young woman who hopes to have kids someday. Is it safe for me to get vaccinated against COVID? I've heard it can impact fertility. Is that true? Why do people think it will impact fertility? If it's not true, then where did that rumor come from? Dr. Henderson?
Yes, so it is safe for women who want to pursue pregnancy now or in the future to get vaccinated. There is not evidence of a link between the COVID vaccine and infertility. The idea behind this theory came from the fact that the COVID-19 spike protein is similar to the syncytin-1 protein, which is a protein that is involved in the formation and function of the placenta. And so obviously a placenta is important in the growth of a baby. So they looked at the genetic sequencing of COVID-19 spike protein and the syncytin-1 protein, and they did not see enough of a similarity to cause a cross-reactive immune response. But despite that, they still went on and studied it. And so they looked at 143 women who were receiving IVF treatment, about 60% who did not have any antibodies to the spike protein, and 40% who did, 65 from being vaccinated and 35 from having a history of the COVID infection. And they looked at their outcomes, and there was no difference in their pregnancy outcomes. So they did not see a lower rate of pregnancy in the women who had antibodies to COVID-19 spike protein. Additionally, in the UK trial for the COVID vaccine, they looked at unplanned pregnancy or accidental pregnancy rates in the two groups, so placebo versus those who received the actual vaccine. And there was no difference in their rate of unplanned or accidental pregnancy. If there was a link to infertility, we would expect those who received the vaccine to have a lower accidental pregnancy rate. If this was biologically plausible, we would also not really expect to have decreased fertility, but we would think that there would be increased risk of miscarriage as the placenta really starts functioning around 9 weeks or more. So they then looked at placentas and said, is there something going on in the placentas? And when they looked at women who were pregnant and not vaccinated versus pregnant and vaccinated, there was no difference in histological markers of inflammation between the two groups' placentas. They did, however, find increased inflammatory markers in the placentas of women who had COVID infection in pregnancy. So just another important reason that we need to prevent COVID in pregnancy.
Thank you. Now, young children. Is the COVID vaccine safe for kids, and do they need to get it if their risk for serious infection is so low? Dr. Dalton?
So the COVID vaccine has proven to be safe in adults, in the teenage population, and now after another rigorous study through the FDA, it has proven to be safe in young children as well. In fact, the studies are showing that the vaccine in the younger children might actually have less side effects and be more efficacious than it has been in the adults and the teenage population. Now, this is a question that I've wrestled with myself, is why get it if their risk is so low? And I've come up with 3 reasons. 1, to prevent direct infection to that child. There is risk of severe infection, severe COVID infection in these young children, even if it is low. And when it is your child, that is a big deal. 2, there's a difference between vaccinating your child and vaccinations as a society. And if we are vaccinating the children, we are spreading the immunity of our whole society against the COVID virus. So if you vaccinate your children, they will not bring that infection home to the older individuals in the household. If you vaccinate your children, they will not take it back to their schools and their churches and all their extra activities and spread the virus other places. And the last reason that I think it's valuable to vaccinate these young children is from a mental health perspective. It's really hard. And I've told many, many, many young children, you have COVID, you need to stay home. And the usual reaction is tears and fear. And so it's really bad for these kids' mental health to live in this world where they're so afraid of this virus. And if and when they do get it, they're afraid they're going to infect their whole family and that they're going to die. So I think it really does help their mental health to be vaccinated, to know that they can continue going to school, that they're not going to have to miss 10 days of school for quarantine. And so this is what I tell every one of my patients.
Can I have a follow-up to that as well? I think you brought up mental health, and I'm actually going to talk about something different. That another reason that I'm really concerned about that, getting our kiddos vaccinated, is that we're continuing to see variants in this virus, and we will expect to continue to see variants in this virus. And the most exciting thing to me about the vaccine is that it is protective against the variants. And right now, our variants are getting smarter and smarter and more evasive of our immune responses and more dangerous. And as that continues, there is a higher and higher chance that our children will get more sick with future variants. And so if they are protected, then they're protected from future variants as well. So I think I just want to make sure we're talking about that viruses evolve. That's what they do. That's what we know that they will do. And having increased immunity as a community, makes decreases the rate of that variant transmission, and can keep us all safe and keep our kiddos safe in the future.
Thank you both so much. Okay, staying on the children, how can we understand the long-term vaccine risks in children when the COVID vaccine is so new? Dr. Dalton?
Well, first of all vaccinations are studied long-term, right? The MMR, the varicella, hepatitis A, hepatitis B, we do long-term studies on all vaccines. And to date, we know of no long-term side effects from any of these vaccines. Going to this particular mRNA vaccine that we're offering children, the Pfizer vaccine, that mRNA that we inject into the system is gone in a moment. It takes a few days and it's out of your system entirely. So the mRNA is gone, and all we're left is the antibodies to the spike protein. This is exactly how a lot of other vaccines work. And we have never had problems with other vaccines. And we do not anticipate at all long-term problems with this vaccine. We will continue long-term studies. Clearly, that is not something that we are going to neglect. And definitely as a physician, I always report any vaccine side effects that I think is out there. And the CDC goes in and investigates them. So the bottom line is we don't expect long-term risks, and we don't have a history of long-term risks from vaccines.
Thank you, Dr. Dalton. Next question. As a pediatric dentist, I have seen an increase in cavities within our children since the pandemic. Do you encourage children who are or are not vaccinated to continue their oral health exams and or treatments? Dr. Gray?
So I'm not a pediatric dentist, but I love this question. I think this is great from the community. We definitely, the answer is absolutely. We want you to continue any of the preventative care measures that we have been doing pre-pandemic. During 2020 was actually one of the years we had some of the lowest preventative care screenings that got missed. We had lower mammograms done, colon cancer screenings, things like that, primarily because we were shut down for quite a bit. And then after that, people were scared to come back. So people were nervous about coming into the hospital, going into a radiology department. And And at this point, at that point, that was very understandable. Now we're long past that. We have safety measures in place. We have vaccinations. We're getting back to maybe a normal task. And we've got to remember that we have to keep up on our preventative screenings. We cannot let those go by the wayside. Those mammograms, those colon cancer screenings, the dental cleanings, all of those things are very, very important. Make sure that you don't miss your appointments with your primary care doctors, your OBGYN, your pediatrician, your psychiatrist. Make sure you make all those appointments. Those are very important for all sorts of aspects of health.
Thank you, Dr. Gray. Now moving on to mental health. Has the pandemic and social distancing made a significant impact on pediatric mental health? And what about women's mental health and postpartum depression? And are vaccines helping with this? Dr. Wakefield.
Thank you so much. I really don't think it takes a psychiatrist to answer this question, though. The answer is yes. It's made a significant impact on children's mental health, on women's mental health, on all of our mental health. This pandemic, the social isolation, the staying home or the separation has affected all of us. And one of the things we know is most protective in the postpartum period for postpartum depression is connection, is social interaction, is having your friend over to hold your baby while you go take a shower, go do something like that. And during this pandemic, we've seen less of that. Just like we've seen less preventative care, we've seen less socialization, which was important to keep us healthy and safe and not overrun our hospitals. But now we have vaccines and we can be vaccinated. And if vaccinated people pass this virus, they pass it at a lower viral load and they pass it for less time. And they stop passing it sooner than other people do. And so we can get back together more quickly, even if we've been ill. We can be safer. We can have trust in that vaccine that we are lowering that transmission and able to gather more frequently together, which is so very important for all of our mental health.
Thank you, Dr. Wakefield. And staying with you, why are people so afraid to get vaccinated?
Fear of the unknown is a very, very natural thing. It's very frequent that we're afraid of something that we've never been engaged in before. So when we have new things, we have a new pandemic, we have a new vaccine, we have a new way of life, we have a new way to go to school, we have a new way to go to work. There is so much newness right now that it is overwhelming to your system. I think an additional thing is that there's a lot of conflicting information out there. I was talking earlier about social media algorithms and how much we are not even in control of the information that we're receiving, and we don't even know it. And so it really depends on what you might have looked at yesterday, what is even fed to you to look at today. So we really have a difficult time being able to filter out the information that we're getting and being able to rank order that information and decide what is valid for us and our situation. So I want to give you a tip. What I do when I'm confused about medical information and I'm not sure what the next step is I call my doctor and I say, hey, here's how I'm feeling. Here's some questions I have. You know my personal situation. What do you recommend here? And that is what I think we have to get back to doing is trusting your clinician to give you that information for your situation.
Thank you, Dr. Wakefield. Now the why category. I'm not at a high risk and COVID numbers are going down in Lubbock. Why should I get the vaccine? Dr. Gray?
So this one should have big, bold letters on the top of it. This is a myth. The COVID numbers in Lubbock, although we may not be hearing them very much right now, we're not paying as much attention to it because it's not the bright, shiny new thing we hear about. We've been hearing about it for a year and a half, almost 2 years now. So our COVID numbers are going up. They are not going down. We actually are one of 4 counties in Texas that have had numbers increasing over the last week. And apparently we got called out from this for our health department. So this is something we need to pay attention to. And just because we've heard about it all over and over and over again does not mean that it's anymore, it's going away or it's not real. The other question here, I'm not at high risk. I see patients every single day, and most of them consider themselves not high risk. And so that's a good conversation to have with your doctor. Yes, there are people that are more high risk than others, but lots of people don't know that they are high risk. There are things that make you higher risk that most people don't even know about. Some people don't know that pregnancy makes you at higher risk for having severe COVID infection and complications. Some people don't know that your weight is actually related. So a BMI plays a factor in that. There's so many different comorbidities, which means having other medical problems at the same time: diabetes, high blood pressure, kidney disease. We can go down the list, but we have seen, and I've lost patients over the past 2 years who have had some with comorbidities, some with several different illnesses at the same time, and some without any at all. I've had young people who have been in their 40s that have lost their lives to the COVID infection. Now, most of these have been unvaccinated. Actually, all of them have been unvaccinated. But it's just something we need to not forget. The numbers are not going down just because we're not living in fear of them as much as we used to, where we don't have to wear a mask every single place we go to or shelter in place. It is still something that's very prevalent in our lives.
Thank you, Dr. Gray. Next question. If my kid already had COVID, why do they still need the vaccine? Dr. Dalton?
Well, if your kid has COVID, I'm new to this, sorry. Okay. You got to remember, with your immunity to anything will wane over time. We do boosters of several different vaccines. You get a flu shot every year. You get an MMR booster at 4. Your first one was at 1. This is, think of it like, think of the COVID vaccine after a natural infection as a booster, right? You had the infection 6 months or more ago. You probably need a booster to continue to have immunity to this disease. It's as simple as that.
Next question. Is there really enough research to trust these COVID vaccines? It seems so fast. Why should I trust it? If it's really safe, then why isn't it fully FDA approved? It only has emergency use authorization. Dr. Almodovar?
Yes, so regarding enough research to trust the COVID vaccines, the answer is yes. So the fact that they got emergency use authorization means that there was a lot of research going on and they were proven efficacious and safe. Now, this research will continue for a few more years, maybe, or a few more months, because we need to gather even more information in more people, including all type of body weights, race, sex, every possible condition, so that they can be fully documented in a bigger population size. Now, chances are that they will be fully approved very soon, again, because there has been a lot of research done during this, especially during this, over these 2 years, to confirm that they are safe to people. Now, to answer the second part of the question, the FDA approval process is very complex. And I have to say that during this pandemic, the process has been streamlined significantly. Things are being done a lot faster now than what is used to be in the regular process when we do not have a pandemic. And the reason is because of the pandemic a lot of people were dying around the world. Something was needed to be done ASAP. So now, regarding the FDA approval process, again, the research starts with a certain number of people, a few people first, and then a few hundreds, a few thousands, and it's moving into phases. And not only that, but the monitoring and the sharing of the information from every single user, from the physicians, from the patients, is important to keep documenting. So this is why it's very, very important that whoever has or do not have a side effect shares that information with the physicians.
May I add into that as well? So I get this question quite a bit in primary care. This is probably the biggest question I get all the time. And so I just wanted to share a little bit of information that is what we talk about in my clinic. So this technology for this mRNA vaccine, because I think that's what everyone freaks out about, is they're like, I've never heard of an mRNA vaccine. Why is that different than the inactivated virus vaccine I get with my flu shot every year? So I think that's the scared because they think it's something brand new that just, popped out of nowhere and we're just throwing it out into people without thinking about it. This is actually not true. This technology is not new. It's definitely not as new as some people believe. The groundwork was actually started in the 1960s and then again in the 1980s. In early 2000, when we encountered viruses like SARS and MERS, I don't know if people remember, hearing all about SARS back then, we actually developed vaccine technology with mRNA vaccines. They were first trialed in 2003 and then again in 2013. And the technology was kind of, we call it reshelved or put aside, just because those viruses didn't end up being a huge community need for them. So they didn't become like COVID-19 infection where it's all across worldwide. So those ones kind of settled on their own. And so a vaccine was actually not necessary at that point. So we kind of set that mRNA technology aside. In 2019, we went back to the shelf and pulled it right back off of there, knowing that it was efficacious, knowing that we had that technology, and we modified it and started to trial it again. To match this new COVID-19 coronavirus. So the coronavirus mRNA technology was already out there. The previous trials have had thousands of participants who have not to this date had long-term complications. This did include women who have gone on to become pregnant without associated complications for them or their infants. The MERS, SARS, mRNA flu vaccines have all been trialed as well. So this technology, bottom line, is not new. So that should not be hopefully something that brings so much fear into it, that this is something that has been around. We just made it and dressed it up again for something different.
That's great information. Thank you, Dr. Gray. Okay, now on to vaccination and pregnancy. Is the COVID vaccination safe to receive while pregnant? Are there any side effects unique to pregnant women? Is there an association with COVID vaccination and miscarriage or stillbirth? Dr. Henderson.
So is the COVID vaccination safe to receive while pregnant? Yes, it is safe and recommended by the World Health Organization, the American College of Obstetrics and Gynecology, SMFM, and the CDC. And when they looked at pregnancy outcomes in people who are pregnant and not vaccinated and pregnant and vaccinated, they had similar outcomes. The incidence of preterm birth, small size for gestational age, congenital anomalies, and neonatal death were consistent between vaccinated and unvaccinated. So there weren't adverse pregnancy outcomes in the group that was vaccinated. Women who are vaccinated who contract COVID-19 will not have as severe disease as women who are pregnant and unvaccinated. So it's very important to have that protection behind you. We personally, as OB-GYNs in both hospitals, have dealt with a lot of I shouldn't say a lot, but enough pregnant women who have had severe complications of COVID-19 that if we had better vaccination, potentially could have been mitigated. You're less likely to be admitted to the hospital if you are vaccinated in pregnancy and develop COVID-19. The side effects between pregnant and non-pregnant are similar. A study in the New England Journal of Medicine showed that rates of local and systemic reactions were similar across the two groups. You'll have mild short-term effects like injection site pain, malaise or body aches, rash perhaps, or low-grade fever. And those may be uncomfortable but are short-term and are just a sign that your body is reacting and learning about that virus so that it can protect you in the future. And association of the vaccine with miscarriage or stillbirth. So there is no association between the vaccine and miscarriage or stillbirth. JAMA reviewed the V-Safe data. So when you get your vaccination, you enroll in V-Safe. They give check-ins to you. You report data on your symptoms or if you get COVID, et cetera. And that really is the only place where pregnant women have been included in data collection, as they weren't included in vaccine trials or treatment trials. So they, excuse me, they found that the rate of miscarriage or stillbirth compared to pregnant women who are vaccinated or pregnant women who are unvaccinated were similar. And so in the general population, the risk of miscarriage is between 10 and 26%. And in the pregnant and vaccinated group, their rate of miscarriage was 12.6%. So actually at the low end of the general population baseline. The same for stillbirth. General risk is 1%, and in the vaccinated group, it was 0.1%. So definitely no finding of increased risk of miscarriage or stillbirth. Like I kind of alluded to before, there is no increased risk of preterm birth, congenital anomalies, or death, but if you are pregnant and get COVID, there is increased risk of preterm labor, need for oxygen, an ICU admission, intubation, and maternal death. So anything we can do to prevent that is important.
Can I add to that? The psychiatrist down here. So I also wanted to say that there will be things that happen after a vaccine, because when you roll out vaccines to this many people all at one time, things would happen even if they didn't have a vaccine. And so if someone, and it's really hard to know, would this have happened to me if I didn't get that vaccine? So as a medical society, we look at, is there an increased rate? Are we seeing increased risk of miscarriage? There may be a woman who got vaccinated and had a miscarriage. Miscarriage is actually very, very common. And so for that individual person, it may feel like these two things happen together because they happened one after the other. But when we look at us as a society and as a whole world, we're not seeing increased risk and increased rates of these things, which means it's most likely that even if you didn't have the vaccine, you still would have had that miscarriage, that they're not related.
That's a good point. Thank you. Is there a risk of fetal malformations as a direct result of COVID infection?
No, we don't have any evidence at this time that having COVID infection will increase your risk of having a fetal malformation or a congenital anomaly. We are still acquiring data on this. I think we don't see an increased risk of miscarriage or stillbirth with mild or moderate COVID infection. It is possible with severe infection that we could see that. But again, as we weren't included in that group of data collection at the beginning, we're still gathering that data.
Could I add one more thing on that a little bit? It's a slightly off topic of that, but it goes along with the fertility aspect. One thing that we have found out is that COVID infection in males actually does affect fertility. It decreases spermatogenesis, which is the creation of sperm, which is how people get pregnant. And so it actually does affect fertility in a way a lot of people don't think about. And so it's actually affecting the male. Now, this may be temporary. We don't know for sure if this is long-term, but we have done studies so far seeing that this is actually something that happens. And so those that may be really excited to have a baby and get pregnant and this is their year, if they maybe want to have their partner maybe think about getting vaccinated. You may want vaccination for you to prevent complications when you are pregnant, but perhaps you want to make sure that you get pregnant in a timely manner. And so that vaccination can help protect your partner as well.
Thank you, Dr. Gray. Side effects. Does the Moderna vaccine cause joint pain after the initial shot or booster? Dr. Gray?
So all of vaccines, the Moderna, the Pfizer, the J&J vaccine, they can have some side effects to them. They are not unexpected at all, and every single person experiences it in a different way. Some are very common, though. You may have some joint pain. You may have some fever. You may have body aches. You may feel nauseous, have a headache. You may feel like you have the flu. That's actually very common, and this is something that some people experience when they have their flu vaccine every year as well. This does not mean anything bad is happening. You did not get COVID from the vaccine. That is absolutely impossible. What happens is that your immune system is ramping up. Think of it that way, is that it's getting a jump start and you're creating antibodies similar to what happens in the flu shot. Then when you create antibodies, your body just kind of goes into overdrive in the immune system and it doesn't make you feel great. But that's just it practicing and learning what it's going to do in case it does come in contact with the COVID virus infection. And so that it will be prepared to fight off that infection in the future.
Thank you so much, Dr. Gray. How can we know that the long-term effects of the vaccine aren't worse than the effects of COVID? That is Dr. Almodovar.
All right. So the vaccine, it's important to remember that the vaccine is coding for the spike protein only. It does not have the whole virus. However, when a person acquires COVID, then your body is fighting against a virus that is replicating and is producing over 50 proteins all at the same time, replicating very fast, invading every tissue. In this case, it takes time for the antibodies to be produced and fight the virus that is actively replicating, which is exactly what you see in COVID disease, the infection. Now, with the vaccine, you're going to produce the antibodies to that protein, and then, like it has been said before, then the body will be ready to fight the virus as soon the moment that is enters or if the person gets infected. Now, I would like to take the minute to clarify something. During the infection process, how fast the virus replicates and invades the tissues is important. The most important thing is that it's acquired in the nasal and the throat area, and then it starts replicating very fast in there. If the antibodies are not fighting the virus right there, then it continues replicating and it continues going deeper in your lungs, and that's when we see the severe COVID. And that's the step that we want to avoid, and that's what the vaccines are great for, because it will stop the virus replication right at the entrance to the body.
Thank you so much. Now we go to personal testimony. Are your children vaccinated, and if so, what are their ages?
So when I was reviewing the questions before this event, I was 100% sure that this question was going to be fielded to myself. Jeremy and I have 6 children, and their ages range from 4 to 13. My 13-year-old was fully vaccinated back in, May or June when it was first released to the 12 to 15-year-olds. I have 4 between the ages of 5 and 11. They're 6, 8, 10, and 11. Thank you. That was work. Anyway, they have had their first dose. We got it on the Friday following the emergency use authorization. They will get their second dose on the Friday after Thanksgiving, and 2 weeks after that second dose, they will be considered fully vaccinated against COVID-19. And then my sweet little 4-year-old has to just bide his time. But we are so happy to be a closely fully vaccinated family. And I will say this, my 6-year-old has been asking me for months when she could get the COVID vaccine. She has a deep hatred of it. And when I talked about mental health earlier, I think it's affected her mental health. She felt the quarantine more severely than any of my children. And in her short lifespan, this is what she knows. And so she knew once she's fully vaccinated against COVID that she will be safer in society, and she will not carry the COVID-19 virus into society. And I'm happy to get her vaccinated. Thank you.
I have a 3 and 5-year-old, 2 boys, and my 5-year-old went this weekend to the Covenant Children's COVID vaccination drive at the mall, so he's had his first shot, and 3-year-old has a little bit of time. But.
So my little one is too young to be vaccinated just yet. He's only 7 months old. So when I started, when COVID kind of happened, it was in the midst of me getting pregnant and kind of treating COVID patients while I was pregnant. There's a lot of fear, and it was very scary at that time. The COVID vaccine came out right at the end of my pregnancy, and so I did choose to get that vaccine to protect my little one. I've been very open about the fact I do breastfeed my little one, and so the talk about passing on antibodies to my child is very, very important to me. And so I like that I can give that protection to him because he is so small. And in a time when things like RSV are scary for moms, the last thing you want to also think about is a COVID virus, harming your little one.
So I have 2 daughters. They are 3 and 4, and that's the only reason for which they are not vaccinated. So if the vaccine gets approved for younger children right away, I will be going with them to the line because I'm looking forward to it. I will not wait for them to get 5. I hope that it can get approved earlier.
And I have 3 children, 10, 8, and a brand new 5-year-old. So we are now all fully eligible for vaccination and really excited to be able to go. I wanted to tell you guys about the health department's vaccination clinic on the 1st and 3rd Saturdays at 50th Street in Boston by the Home Depot from 10 to 2 p.m. So we're really excited. And I do have to say that my 5-year-old, when he turned 5, he said, "Can I get the vaccine now?" And I said, yes. And we were talking about who was going to get their shot first. And he said, "I get to go first." And they were actually arguing with each other about who gets to go first. So I think of my kids as kids who have not really been affected by the pandemic. I think they've been able to run and play and do all of these things that kids who live in other communities and in high-rise apartments and things were not able to do that even during the, and they were able to do that even during the lockdown. But when we talked about the vaccine getting approved for 5 to 11-year-olds, they all 3 started clapping. And it just made me realize how they have been feeling this pandemic, even when I think I've been protecting them of all of these things. So it's such a beacon of being able to move forward.
Thank you all so much. And thank you so much for answering the citizen-submitted questions. We're going to move now to media questions. So if media partners want to come up to the stand mics here one at a time and ask their questions, and panelists, y'all can, whoever wants to answer it can. Take your time. Not everybody at once.
I would like to ask about one of the statistics I believe you threw out earlier about the overall COVID prevalence within Lubbock County. I don't know if that's on. Y'all can hear me, right? Did you say Lubbock is one of 4 counties in Texas with rising COVID cases?
Yes.
Okay. I just wanted to clarify that because that was pretty jarring when I heard it. And this could go for you, Dr. Gray, or Catherine. Why do you think that is? Is there something about the behavior or the policies here in Lubbock County that may make our rising cases different from other similar counties?
I'll go ahead and address that one. Typically, the couple of other times that we've started to see increases in the state of Texas, unfortunately, Lubbock and Amarillo area have all shown those increases first. The other areas that are also showing increases is El Paso. And we're just closely monitoring it. We're looking at that 7-day average of new cases being diagnosed, and that's where that statistic is coming in. We saw a large decrease. We've seen that data plateau, and over the last couple of days, we've seen that begin to increase.
Interesting.
So we'll be closely following that.
Okay. That's all I wanted to clarify. Thank you.
Thank you. Anybody else? Well, that's easy. Okay, well, this concludes our, well, first let me ask, do y'all want to add anything? Anything?
So I do think it's difficult to find good information, and I do echo what Dr. Wakefield said. And if you have questions, please call your OB-GYN, your family medicine doctor, your nurse practitioner, whoever it may be, and ask those questions, get your answers. I do think that at Mama Dr. Jones is a really good resource when you're looking for information about pregnancy, vaccination, and any OB-GYN information at all. And she was very helpful in preparing me for today. She's also a Texas Tech alum, so Reckham.
I didn't know that.
Yes. College and med school. So that is one example of a reliable source that y'all can reach out to.
And I'm not saying I'm by any means an expert, but we in our clinic, in my UMC clinic, we try very hard to help reach out to our patients and to the community to try to share some of this information, to share information from some of our other amazing doctors at Covenant, TTUHSC. I'll give a little plug that I do have a social media that does share this information. It's Dr. Jessica Gray, MD, and so you can definitely follow, and I can show you all the fun health department stuff that we talk about as well.
Well, and I'll just have a shout out to our health department in general, that Catherine Wells and the city of Lubbock and our health department has done a phenomenal job of gathering information and getting evidence-based information out to our community. And so if you have questions, please direct them to the health department or to your physician or clinician, because we're really, really lucky. I mean, I know our numbers are rising and we seem to lead, and I don't like that, but I think that we have phenomenal experts in our community who really want the best for all of our citizens.
One thing I just want to give a shout out to them that they shared with us is that there apparently aren't any other health departments in the state of Texas, you can correct me if I'm wrong, that are putting on together an event like this, where we have cross-collaboration across different institutions all across Lubbock. We're bringing in doctors who are unpaid. Everyone's volunteering here. Nobody is backed by big pharma. Nobody even has a government relation to anything. This is not political. This is 100% out of the goodness of our hearts, something that we want to just talk to you guys about. Make sure we give out information that is evidence-based, which means it's factual. There's scientific studies to prove it. It's not just one random thing that you heard on the internet or you Googled. So we want to really thank them for allowing us to all come together to talk to you guys and give out this information.
We thank y'all so much. We knew this was a unique event, but just that y'all were so gung-ho. We've been working on it for months, trying to make it happen, and I'm so glad it finally did. So this concludes our Women's Health Town Hall, brought to you by a partnership with the City of Lubbock, Covenant Health, UMC Health System, and Texas Tech University Health Sciences Center. We want to thank our media partners and our community partners like Lubbock Moms, who helped us promote and cover this event. And a huge thank you to our doctors and to Lauren Adams with the city's Communications and Marketing Department for making this all happen. So I'm Lacey Nobles. We hope you have a nice evening and a happy Thanksgiving.